Okay, so all right. So welcome back, and thank you for sticking around. Now, tell us, is how's the network now? How's the network now? So tell us if we are still, if the network is still breaking. We've had to change from one network to another. Let's see if this works. If it does work, then we'll be happy to proceed. So please give us the usual feedback that you gave us earlier. If you are happy with the network, you are happy with the sound, we can proceed with our conversation and finish it. Okay. And thank you for sticking around, for those of you who have stuck around to finish this. Is the network okay now? Oh, good. Thank you. Thank you for the feedback. What's your name? Betha Lisa. Thank you. You're saying much better. Okay, that's good. Okay, right. And the audio is much better. The network is much better. It's more stable. Thank you. So let's go back to our conversation. So like we said, we are discussing typhoid fever. Now, we're going to start from the beginning. For those that may have missed the earlier conversation that we have abandoned because of technical issues. So I'll start from the beginning. All right. So today we are discussing typhoid fever. Now, the background to this is that for me personally, about a few weeks ago, a colleague of mine conscientized me and says, bro, we could have an outbreak of typhoid. We are seeing all these cases that are very suspicious. That was a few weeks ago. And I think about yesterday, a few days ago, even today, I saw a headline in the papers where the Ministry of Health has expressed concern that they've even heightened their surveillance and suspicion of typhoid. Now, why are we concerned? Why are we concerned? Why is the ministry also concerned? Is because typhoid is a notifiable disease. Why is typhoid notifiable? Is because when you do not treat typhoid properly, it actually kills people. It can kill you. And if it doesn't kill you, it can leave you with very serious complications. Now, typhoid, you may ask, what are the symptoms? Like, how would you know that someone has typhoid? Or yourself, or your loved one? How would you know that? When should you start suspecting that someone has typhoid? With all this information that's going around, when should you suspect? Here's how you should suspect that someone has typhoid. The first thing you will notice is the temperature. Okay? Patients who have typhoid or people who have been affected by typhoid, their temperatures are usually extremely high. They're usually above, 39, 40, 41, they're about crazy, crazy temperatures. Then you start thinking this could be typhoid. Before, usually people start suspecting maybe you have malaria, bunch, but no. Even typhoid has crazy high temperatures, very high actually. The next thing you may notice in someone who has typhoid is that they may have a rash around the neck or around the belly. If it's a child, you may look out for a rash. So if someone has a rash and they have a very high temperature, really, really crazy high, then start suspecting that this could be typhoid. But there are other features in addition to this that you must also be paying attention to. It's abdominal discomfort, abdominal pain. In addition to that, they may or may not, but they usually do have a diarrhea. And the diarrhea may have blood or it may not have blood, but they would have diarrhea as well. So when you see those things, okay, start thinking, this could be typhoid. Now, in addition to the symptoms I've given you, they may also present with things like general body weakness, which is lethargy, and other features, joint pains sometimes, okay? Joint pains sometimes. But the ones I've given you are the common features you should look for. Very high fever, abdominal discomfort, diarrhea, which may or may not be bloody, start thinking typhoid. They may even have a rash, start thinking typhoid. They may have a headache as well. So the symptoms I've given you, most people will start thinking, this could be malaria or branch. Because there's a high index of suspicion now, there's even sporadic cases that have been reported by the Ministry of Health itself. You need to start getting concerned, because typhoid, you don't play around with it. And if you suspect that your patient could have typhoid, rush to the hospital. Don't waste time at home. This is not a disease that you play around with. Rush to the hospital. All right? Now, what are the causes of typhoid? How do you catch typhoid? You catch typhoid because you've eaten fecal matter, someone else's fecal matter. That's how you catch typhoid. It's an oral fecal disease. And typhoid does not pass through human beings, does not pass through animals. So it's human to human. So when you see someone has typhoid, then it means that they have literally ingested someone else's fecal matter. And the way they've ingested that someone else's fecal matter is through contaminated water, contaminated food. All right? It's through contaminated water and contaminated food. So you have to ask yourself, as you drink water, the way we invite you to drink water on this page, check, is your water clean? What's the source of your water? As you eat food, have you washed your hands? Are you comfortable with the source of your food where you're eating it? Is the food warm? As you are eating fruits in the streets, make sure you peel the skin. Wash your hands, peel the skin, or clean the fruit as much as possible. Otherwise, you will catch typhoid. Now, the reason we are worried about typhoid is that if it is not treated, here's what it does to you. So, typhoid is caused by a very specific type of bacteria called Salmonella. Now, Salmonella has so many types, okay? Now, the one we worry about the most is Salmonella typhi, which is the one which we're interested in today. With that particular bacteria, once you have ingested someone else's fecal matter, either through water or food or anything, the bacteria goes into your tummy and into your intestines. It will stay in your intestines for a few days. Then it will have access to your bloodstream and it will stay in your blood. The reason your body struggles to fight this bacteria, it is because this bacteria has a very clever mechanism of avoiding your immune system. It goes to sit inside your own cells so that when your immune system approaches, it can't see the bacteria. It only sees cells that are friendly. And that's how it is able to avoid detection from your immune system. It's because it is able to hide inside the cells. And that's how come some people are even carriers of this disease. It is because for those who don't have symptoms and they are infected, they become carriers. Now, the challenge you have with carriers is that they are able to transmit the disease to other people. Okay? They are able to transmit the disease to other people, carriers. That's why you find that authorities like the Lusaka City Council Public Health Department, they go around in these restaurants to go and test food handlers. One of the things they worry about with food handlers is typhoid. So they test them. It's very important to test them. Especially people who handle food for the public. They need to be tested for typhoid from time to time. It's very important. Now, if typhoid is not treated, here's what happens. It will perforate your intestines. It will create holes in your intestines. When it reaches that stage, then you will need surgery for them to go and remove the intestines that are perforated. Now, here's the problem. When typhoid reaches that stage, where it even has perforated your intestines, very few people survive. Very few people survive that. Very few. Prevention. How do you prevent typhoid? And here I need you to pay close attention. Because typhoid is very common and prevalent in low socioeconomic settings, such as ours and other parts of the world where you have low socioeconomic settings, where people are poor, where people have no access to clean water, where people have no access to toilets. Typhoid is very, very common in such areas. So how do you prevent it? Because we are in the hot season as we speak, and we are in a season where rain is about to start, diarrheal diseases are increasing. Ladies and gentlemen, the first thing you need to be doing to prevent typhoid for yourself, your children, and your loved ones, wash your hands regularly. After using the toilet, wash your hands regularly with water and soap. Okay? Some of you are asking me, Doc, how about is a hand sanitizer? Well, fine, you can use a hand sanitizer, but water and soap is very adequate. Wash your hands regularly. Secondly, in this period, pay attention to where you are eating from. Make sure you are confident that you are eating from a place that is clean, a place that is observing hygiene, a place that is hygienic. If you are going to buy fruits from the street, no harm. Make sure that you wash those fruits thoroughly. Don't eat the skin of those fruits. Peel the skin, throw it away, but make sure your hands are washed and then you eat. But in a broader sense, for example, if you are traveling into this country or other countries where you know there's typhoid, pay attention. Ideally, you want to be drinking water which is bottled. This mineral water which is bottled, it's assumed to be cleaner than ordinary tap water or ordinary well water. Okay? And others have argued that probably, because you see, typhoid also has a vaccine. Okay? Especially for travelers, there's a vaccine to it. But then you see others have argued that maybe the vaccine may not be as effective. Others have argued that the vaccine is effective. So you may want to consider that. Now, in a more broader sense for us here in Zambia, for us to eradicate not just typhoid, but dysentery and cholera, we need to increase access to clean water for our population. We need to increase access to toilets, because these diseases, especially diarrheal diseases that are orophycal, it is because people are consuming fecal matter. There's no other way of saying it. Okay? There is no other way of saying it. When you hear this typhoid, it is because people have ingested someone else's fecal matter, either through water or food. That's the way it is. So to prevent it, wash your hands regularly. Make sure your food is thoroughly washed. Make sure that the food that you're eating, if it's cold, again, avoid things like putting ice in your drinks when you go out to drink. You guys who enjoy a drink over the weekend, avoid putting ice in your drink for now. Okay? Because it thrives in those environments, especially if you don't know the source of the water that they use to make the ice. If you're carrying your own ice, fine. But even you, just make sure. So that's that about typhoid. And that's why we worry. And that's why even the ministry had to issue a statement on typhoid. It is not a disease to play around with. So now that you know the symptoms, if you suspect, take the child or yourself to the hospital. Now that you know how to prevent it, practice those preventive measures. They are simple but effective. All right? They are simple but effective. But here's what is even more important. When typhoid is diagnosed early, it is completely treatable. It's a very easy disease to treat. It's completely treatable, except that it can easily complicate into the issues I'm telling you about. All right? It can easily complicate into the issues I'm telling you. And that's why we worry when we hear about it, because it can actually kill people. And you don't want that. Okay, so do this. Share this video as widely as you can. Someone was asking me, Doctor, how about vomiting? Is it a feature of typhoid? Yes, it is. They do vomit. Diarrhea and vomiting. Yes, it is. Okay. So now, go ahead and share this video as widely as you can. Click that share button. We need as many people as possible warned through these platforms. You can download this video and share it wherever you want to share it. For us, what we want is for information to go out as much as possible. And we'd also like to thank CarePIC Specialist Clinic for making this conversation possible. As you are aware, this live broadcast has been sponsored by CarePIC Specialist Clinic. Okay, so do take care and look after yourselves in this season. Okay, and also what is also important, I also forgot to mention that in the process of treatment of typhoid, you have to give someone a lot of fluids because they tend to have diarrhea. All right, so continue to drink water, continue to wash your hands, particularly in this season, and take care of yourself.